I want you to think about something for a moment. When did you last wake up in the morning without tingling in your hands or feet? When did you last go through an entire day without that burning, crawling, electric sensation running up your legs? When did you last feel truly comfortable in your own body, without numbness, without shooting pain, without the constant feeling that something is deeply wrong? Weakness in the hands or feet, loss of balance, or the feeling that your feet are wrapped in thick, invisible socks? Pay very close attention. If you are over 60 and you are experiencing any of those symptoms, tingling, burning, numbness, or electric shooting pain, because what is happening inside your body right now is not something you simply have to accept as an inevitable part of getting older. And the solution may be something so simple, so affordable, and so powerfully supported by research that it is going to genuinely surprise you. I'm Dr. Marty Macri. In my years of practice, I have seen thousands of patients over 60 suffering from nerve damage, what doctors call peripheral neuropathy, who were told by their physicians that there was nothing to be done, that nerve damage was permanent. But I am here today to tell you that in many cases, that is simply not the full story. Because the research, real peer-reviewed research published in respected scientific journals, tells a different and far more hopeful story for a significant percentage of people with nerve damage. A story that involves one specific vitamin, a vitamin that most Americans over 60 are deficient in. A vitamin that plays such a fundamental and irreplaceable role in nerve health, nerve repair, and nervous system function, that without adequate levels of it, nerve damage is virtually guaranteed to progress. And with optimal levels of it, documented nerve regeneration and symptom reversal becomes possible. That vitamin is vitamin B12, and before you think, oh, I've heard about B12, I already know about B12, I want you to stay with me. Because what most people know about B12 is only the surface of an extraordinarily deep and important story. And the specific details I'm going to share with you today, about dosing, about the right form of B12, about timing, about what to combine it with, and about why taking it before bed specifically makes a measurable difference. Most doctors never explain any of this to their patients, and that gap in knowledge is costing millions of seniors years of unnecessary suffering. Let me start at the very beginning. Your nervous system, the vast, intricate network of billions of nerve cells that connects your brain to every single part of your body, is one of the most metabolically demanding systems in your entire body. Your nerves are constantly working. Even right now, while you are watching this video, your nervous system is regulating your heartbeat, managing your breathing, processing every sensation your skin is feeling, coordinating your balance, controlling your digestion, and performing thousands of other functions simultaneously. To do all of that work, to maintain all of those functions at the level your body requires, your nerves need a constant and adequate supply of very specific nutrients. And at the top of that list, sitting above almost everything else in terms of its critical importance to nerve health, is vitamin B12. Here is why. Every nerve fiber in your body is surrounded by a protective coating called the myelin sheath. Think of myelin like the plastic insulation around an electrical wire. Its job is to protect the nerve fiber, to keep electrical signals moving quickly and efficiently along the nerve, and to prevent those signals from leaking out or short-circuiting. When your myelin sheath is intact and healthy, nerve signals travel at full speed. When it begins to break down, when it thins, when it cracks, when it erodes, nerve signals slow down. And that breakdown of the myelin sheath is exactly what produces every single symptom of peripheral neuropathy that I described at the beginning of this video. Without sufficient B12, your body literally cannot make healthy myelin, and without that protection, nerve damage is not a possibility. It is a mathematical certainty over time. Now here is where the story becomes critically important, specifically for people over 60, because B12 deficiency in older adults is not rare, it is extraordinarily common. Studies published in the American Journal of Clinical Nutrition estimate that between 10 and 30% of adults over 60 have low or borderline low B12 levels. Other research puts the number even higher, with some studies suggesting that nearly 40% of elderly Americans are not getting adequate B12 for optimal nerve function. And here is the cruel twist. The reason older adults are so vulnerable to B12 deficiency has nothing to do with how much B12 they are eating. The problem is absorption. As we age, the stomach produces less of a critical protein called intrinsic factor. And intrinsic factor is absolutely essential for B12 absorption in the gut. Without adequate intrinsic factor, you can eat all the B12-rich foods in the world, and your body will absorb almost none of it. The B12 passes right through you. Your blood levels drop. There is another group of older adults who face an even more severe B12 absorption crisis. If you are taking a medication called metformin for type 2 diabetes, this affects tens of millions. Research published in the British Medical Journal has documented clearly that long-term metformin use significantly depletes B12 levels. The longer you take it, the more your B12 drops. Because diabetes itself already damages peripheral nerves, the combination of metformin-induced B12 depletion creates a devastating double attack on the nervous system. Similarly, if you are taking acid reflux medications like omeprazole or lansoprazole, research shows that long-term use of these also significantly impairs B12 absorption. Millions of seniors take these medications every single day, often for years, without ever being told that they may be quietly depleting the one vitamin their nerves need most. So we have an aging population that is already absorbing less B12 due to declining intrinsic factor production. We have tens of millions of those same people taking medications that further deplete B12. We have a medical system that does not routinely test B12 levels in seniors unless they specifically ask. And we have the result: widespread, silent, progressive B12 deficiency driving a massive epidemic of peripheral neuropathy in Americans over 60. This is not a mystery. This is a documented, measurable, preventable public health crisis. Now let me tell you what the research shows about B12 supplementation and nerve repair, because this is the part that genuinely changes lives when people understand it fully. A landmark study published in the Journal of Neurological Sciences followed patients with peripheral neuropathy caused by B12 deficiency. The results were remarkable. Patients showed measurable improvement in nerve conduction velocity, meaning the speed at which electrical signals traveled along their nerves actually increased. Patients reported significant reductions in tingling and burning. Balance scores improved. And nerve biopsy data showed actual regeneration of nerve fibers in a significant percentage of participants. A separate study published in Nutrients Journal examined patients with diabetic peripheral neuropathy who received methylcobalamin, a specific form of B12 we are going to talk about in detail in just a moment, and found significant improvements in pain scores, vibration sensation, and overall nerve function scores, compared to patients who received standard care without B12 optimization. And a meta-analysis, a comprehensive review that pooled data from multiple studies published in the Cochrane database, concluded that B12 supplementation shows genuine promise as a treatment for peripheral neuropathy, with the strongest evidence supporting high-dose methylcobalamin specifically. Now I said methylcobalamin, and that word matters enormously, because not all B12 is created equal. When you walk into a pharmacy or go online to buy B12 supplements, you will typically see two main forms. Cyanocobalamin is a synthetic form of B12 that your body must convert into an active, usable form before it can actually be used by your cells. The second form, less common, more expensive, but dramatically more effective for nerve health, is called methylcobalamin. In young, healthy people, this conversion happens reasonably well. But in older adults, particularly those with certain genetic variations like MTHFR, this conversion is impaired. In young, healthy people, this conversion happens reasonably well, but in older adults, particularly those with certain genetic variations like MTHFR, this conversion is impaired. The standard recommended daily allowance for B12 in adults is 2.4 micrograms per day, and if all you are trying to do is prevent a basic deficiency in a young, healthy person, that amount is adequate. It crosses the blood-brain barrier more effectively. It is retained in tissues at higher levels. At very high doses of B12, a small percentage is absorbed through passive diffusion, a completely different pathway that does not require intrinsic factor at all. So the first critical piece of information? If you are going to supplement B12 for nerve health, make sure you are taking methylcobalamin, not cyanocobalamin. Check your current supplement bottle right now. Read the label carefully. If it says cyanocobalamin, consider switching to methylcobalamin. Now let us talk about dosing, because this is another area where the standard advice that most doctors give falls dramatically short. Your nervous system uses the quiet of sleep to do the repair work that daytime activity prevents. What this means practically is straightforward and powerful. But for an older adult with compromised absorption, remember the intrinsic factor problem we discussed, and especially for someone trying to repair nerve tissue, 2.4 micrograms is nowhere near enough. The second companion nutrient that dramatically amplifies the nerve healing effects of B12 is vitamin B6, specifically in its active form called P5P. B6 in its P5P form plays an essential role in the synthesis of neurotransmitters, the chemical messengers that allow nerve cells to communicate. This means that even seniors with reduced stomach acid can absorb meaningful amounts when the dose is high enough. The math works in your favor when the dose is therapeutic rather than merely preventive. This is a condition called B6 toxicity neuropathy, so the dose matters enormously. More is absolutely not better with B6. Sublingual absorption studies show that this delivery method achieves blood levels comparable to B12 injections in many patients. For seniors with severe absorption issues, it can be genuinely transformative. Now, why before bed? This is the question at the heart of today's video. And the answer involves some fascinating science about how your nervous system actually repairs itself. The nervous system does not heal in days the way a skin cut heals. Myelin repair and nerve fiber regeneration occur at a pace measured in weeks and months. More substantial improvements, reduced pain scores, and better balance typically become apparent between 3 and 6 months of consistent use. You must give the nervous system the uninterrupted, sustained nutrient supply it needs. Nerve regeneration requires patience and commitment. Your nervous system uses the quiet of sleep to do the repair work that daytime activity prevents. What this means practically is straightforward and powerful. If you take your methylcobalamin before bed, you are giving your nerves the raw material they need exactly when they need it most. Get your B12 levels tested, get a complete neurological evaluation, understand what is causing your nerve symptoms before assuming it is simply a nutritional deficiency. Now, let me tell you about the most powerful combination, because B12 alone works even better when paired with 2 specific companion nutrients. The first companion nutrient is alpha-lipoic acid, often abbreviated ALA. It is a unique antioxidant that is both water-soluble and fat-soluble. In the early stages, when tingling is occasional, the damage is primarily to the myelin sheath. The nerve fiber itself is still intact. The researchers described the improvements as clinically meaningful, genuinely noticeable, and life-improving for patients. And like your methylcobalamin B12, taking it before bed allows it to be present in your system during your nervous system's peak repair hours. Which is why the single most important thing I can tell you today is this: do not wait. If you have symptoms now, the time to act is now. Chronically elevated blood sugar is toxic to peripheral nerves. Sugar molecules damage the structure of nerve fibers in a process called glycation. Tonight, you can begin changing the trajectory of your nerve health. Not next week, not after you feel worse, tonight. However, and this is critically important, B6 supplementation requires care. At very high doses above 100 milligrams per day, B6 can actually cause nerve damage. A landmark study published in the Journal of Neurological Sciences followed patients with peripheral neuropathy caused by B12 deficiency. For nerve health support, research supports doses in the range of 25 to 50 milligrams per day of P5P form B6. Therapeutic, but well within the safe range. So, the complete before-bed nerve repair protocol that the research supports looks like this. All taken together before bed with a small amount of food or healthy fat to optimize absorption of the fat-soluble components. Now I want to be honest with you about timelines, because managing expectations is part of responsible medical guidance. Nerve repair is slow, balance scores improved, And nerve biopsy data showed actual regeneration of nerve fibers in a significant percentage of participants. Most people report the first noticeable improvements, a slight reduction in tingling or slightly better sleep, within 4 to 6 weeks, and found significant improvements in pain scores, vibration sensation, and overall nerve function scores. And the word consistent is everything. One of the most common mistakes is starting feeling slightly better and then stopping because life gets busy. The research on nerve regeneration uses doses that are orders of magnitude higher. Studies have used doses ranging from 500 micrograms all the way up to 1500 micrograms per day of methylcobalamin. It requires showing up every single night with the right nutrients at the right dose, even on the nights when you do not feel like it. Let me also address something important. This protocol is nutritional support for nerve health, not a substitute for medical diagnosis and care. There is also a form of B12 that bypasses the absorption problem entirely: sublingual methylcobalamin. These are tablets that dissolve under the tongue, allowing direct absorption into the bloodstream. If you are experiencing significant nerve symptoms, persistent tingling, numbness, burning pain, loss of balance, or weakness, please see your doctor. There are causes of peripheral neuropathy beyond B12 deficiency: uncontrolled diabetes, thyroid disorders, autoimmune conditions, certain medications, or alcohol. Some of these require specific medical treatment. The protocol I have described today works best as a complement to proper medical care, not as a replacement for it. Now I want to share something that makes this entire conversation even more urgent, because there is a timing component to nerve repair that most people do not understand. The recommended dose of alpha-lipoic acid that appears in the research literature for nerve health is between 300 and 600 milligrams per day. And that changes everything about why you should start this protocol sooner rather than later. Peripheral nerve damage exists on a spectrum, and myelin, given the right nutritional support, can regenerate. The protective coating can be rebuilt. Symptoms can genuinely reverse. This is the most powerful stage to act. Alcohol, smoking, and a sedentary lifestyle also accelerate damage. Even gentle daily walking for 20 minutes measurably improves peripheral circulation. In the middle stages, when numbness has become persistent, some nerve fiber damage has occurred alongside the myelin damage. Regeneration is still possible, but it is slower. And in the advanced stages, when nerve fibers have been completely destroyed, the damage may be irreversible. Dead nerve fibers cannot be brought back, and sleep itself must be protected. 7 to 8 hours of high-quality sleep is not a luxury. It is a medical necessity and part of the treatment. Not next month, not after your next doctor's appointment in 3 months. Now. Every week of delay is another week of myelin erosion. The nervous system is remarkably resilient, but it is not infinitely patient. Give it what it needs while it still has the capacity to use it. So let me bring everything together for you now. The single most powerful intervention is optimizing B12, taken before bed. Prepare for your first night of the protocol. Take your supplements, fill a glass of water, and commit to this process. You deserve to heal. I'm Dr. Marty Macri. Share this video with someone who needs it. Take care of your nervous system. I'll see you in the next one. I want you to think about something for a moment. When did you last wake up in the morning without tingling in your hands or feet? Methylcobalamin B12, 1000 micrograms. Alpha-lipoic acid, 300 to 600 milligrams. Pyridoxal 5-phosphate B6, 25 to 50 milligrams. Most people report the first noticeable improvements, a slight reduction in tingling or slightly better sleep, within 4 to 6 weeks. Substantial improvements appear between 3 and 6 months. More substantial improvements, reduced pain scores, and better balance typically become apparent between 3 and 6 months of consistent use. Consistency is the key. When did you last go through an entire day without that burning, crawling, electric sensation running up your legs? It requires showing up even on the nights when you do not feel like it, even on the nights when you are not sure it is working. Set a reminder and make it a habit. There are causes beyond B12 deficiency: uncontrolled diabetes, thyroid disorders, autoimmune conditions, certain medications, or alcohol. Some require specific medical treatment. When did you last feel truly comfortable in your own body? Without numbness, without shooting pain, without the constant feeling that something is deeply wrong? Because what is happening inside your body right now is not something you simply have to accept as an inevitable part of getting older.